Pregnancy is a beautiful journey, filled with anticipation and joy. If you've recently been diagnosed with gestational diabetes, it's natural to have questions and concerns. But don't worry, you're not alone, and managing it is entirely possible. This video will guide you through the most important tool you have for a healthy pregnancy with gestational diabetes. So, what is gestational diabetes? It's a type of diabetes that can develop during pregnancy in women who don't already have diabetes. It means your body isn't able to produce enough insulin to meet the extra needs of pregnancy, leading to high blood sugar levels. For most women, the good news is that it goes away after the baby is born. Why is your diet so crucial? The food you eat directly impacts your blood sugar levels. By making smart dietary choices, you can help keep your blood sugar in a healthy range, which is vital for both your health and your baby's development. A well-managed diet can reduce the need for medications and lower the risks of complications. In fact, many women are able to manage their gestational diabetes solely through diet and exercise. I'm feeling particularly motivated today because we're seeing such positive results. Just recently, 2 of my patients with gestational diabetes delivered healthy babies. They were both successfully managed primarily with dietary modifications. Their blood sugar levels remained well controlled, which allowed them to enjoy a normal, balanced diet without unnecessary restrictions. And importantly, they gained just the right amount of weight for a healthy pregnancy. It's truly inspiring to see these outcomes, and it reinforces how effective these strategies can be. Managing gestational diabetes with your diet might sound complicated, but it's based on a few key principles. Let's break them down. First and foremost is carbohydrate management. Carbohydrates, or carbs, are found in foods like bread, rice, pasta, fruits, and starchy vegetables. They break down into glucose, which is your body's main source of energy. With gestational diabetes, the goal isn't to eliminate carbs, but to control the amount you eat at one time and choose high-quality, complex carbohydrates. Think whole grains, beans, and lentils. These are digested more slowly, preventing sharp spikes in your blood sugar levels. Next up are protein and healthy fats. Including a source of lean protein like chicken, fish, eggs, or tofu in every meal and snack is essential. Protein helps to stabilize your blood sugar and keeps you feeling full and satisfied. Healthy fats, found in foods like avocados, nuts, seeds, and olive oil, are also an important part of a balanced diet. And finally, let's talk about meal timing and frequency. Instead of 3 large meals, aim for 3 smaller meals and 2 to 3 snacks spread throughout the day. Eating every 2 to 3 hours can help keep your blood sugar levels steady and prevent hunger pangs. It's especially important not to skip breakfast, as this can lead to higher blood sugar levels later in the day. Now, let's get practical. What does a healthy plate for gestational diabetes look like? Here are some ideas to get you started. For a blood sugar-friendly breakfast, try 1 or 2 slices of whole wheat toast with avocado and a hard-boiled egg. Another great option is a small bowl of plain Greek yogurt with a handful of berries and a sprinkle of chia seeds. When it comes to lunch and dinner, a good rule of thumb is the plate method. Fill half your plate with non-starchy vegetables like broccoli, spinach, or bell peppers. 1/4 of your plate should be a lean protein source, like grilled chicken or salmon. And the last quarter should be a complex carbohydrate, such as a small portion of quinoa, brown rice, or a whole wheat roll. Snacking is important to keep your energy levels up and your blood sugar stable. Some great snack ideas include an apple with a tablespoon of peanut butter, a small pear with a slice of cheese, or a cup of vegetable sticks with hummus. Sometimes, even with the best diet, blood sugar levels can be stubborn. This is where medication like metformin can be helpful. For example, one of my patients who was admitted today for her delivery was initially managed with diet alone. For the last 3 months, she's been on a minimal dose of metformin, which has worked wonderfully to keep her blood sugar stable while still allowing her to eat well. It's a safe and effective option that can be a great tool in our evidence-based approach to management. To make it even simpler, here's a quick rundown of foods to focus on and those to be mindful of. Fill your plate with plenty of non-starchy vegetables, lean proteins, and whole grains. Healthy fats in moderation are also your friend. You'll want to limit or avoid sugary drinks like soda and juice, as well as desserts and sweets that are high in added sugar. Be mindful of refined carbohydrates like white bread and white rice, as they can cause a rapid rise in blood sugar. Also, some fruits are higher in sugar, so it's best to eat them in moderation and pair them with a protein. Remember, you're in the driver's seat when it comes to managing gestational diabetes. These dietary changes, sometimes with the help of medication, can make a huge difference for you and your baby. It's essential to work closely with a dietitian or doctor. They can help you create a personalized meal plan that meets your individual needs and preferences. They'll also guide you on monitoring your blood sugar levels, which is a key part of your management plan. If you're looking for guidance and would like to discuss a personalized plan, you can take an appointment with Dr. Pankaj Kumar to ensure you have the support you need. This journey might have its challenges, but you have the power to make healthy choices for a bright and healthy future for both you and your little one. You've got this.